Could you think of any other questions or any other points a new doctor would ask? I mean, if they ask about GMC registration, I'll make a small separate video and then run through those steps about GMC and visa. But from the psychiatry perspective, could you think of like any questions from your journey, from your experiences working with new doctors? I think these
Um,
are the challenges
I think one of the things which people in psychiatry worry about is that language barrier. They say that, if you're coming to UK, will be able to speak good enough English, but I believe if you have passed the OET or IELTS according to the GMC's standard, I think then your English would be good enough. Obviously, you will learn new slang, you will hear slangs, you will hear new accents. Then there's a whole aspect of understanding how things work here and all that. That is something you will get used to it. But generally speaking, the IMGs I've seen coming from India, Pakistan, Bangladesh, Egypt, Nigeria, their English is actually pretty good enough to actually practice in psychiatry, and good enough to pass the exams as well. The other thing you will find in psychiatry, the workforce is a lot more international. It's quite a lot international actually. At least the trusts and places I worked in, they were actually more IMG doctors, starting from the top, clinical director level, consultants and all that. They were actually more international doctors than the British doctors. And I think that's because a lot of the British doctors don't take up psychiatry, and a lot of these posts are actually filled by the international doctors who come and take those. So you're not in a you you shouldn't really struggle with the language. This is something that is stuck in our mind, that I might not be able to cope with that. But I think you, as an international doctor, you do cope well with that.
Manan, your version or any questions from your point of view that doctors would face or ask?
I think a couple of things, just sort of broad, um, two bits from my side or reflections from my side to anyone who's lived in a very different system than the UK. A couple of things is, if please don't come from a place of, oh, I need to be called sir and madam and need to get that, start off from a place of humility and people calling you by first names, but then you also calling your supervisors by your first names. That is a different culture that we want to sort of imbibe on the day we move, before we move, or at least within the first couple of months that we move. Two, it's extremely important that if you make a mistake, because the audits and the systems are so evolved, you are going to get caught if you make a mistake. So please just be honest and accept it. It's fine. It's completely fine to come from a place of honesty and make a wrong decision or do something wrong, and then accept it. It's fine. But please don't try to sort of pile on over it or go around and around. That's something that usually annoys a lot of people. And third, I think it's really important to come from that student mindset that I want to think and learn. When you're moving, don't come and put a lot of pressure on your shoulders that, oh, I'm moving for life, nothing's going to change. And this, don't overthink all of that. Just come from a point of view of getting some exposure and learning about different cultures. And then usually what happens is by 6-8 months, people feel like, okay, I really like and enjoy working here. That mindset, I've seen people make or break within the first 6-8 months. All the people that I've seen make a decision, positive or negative, they make it within the first 6-8 months. And when they sort of break it's usually because of one of these three things. Either an expectation of a lot of respect, which they might have gotten used to. Now, whether that respect's true or false, you that's up for debate. That honesty, and that third thing, coming from a place of learning and not enjoying the process at the end of the day, because you're coming here to be happy. You're not coming here to put a lot of 10 kilos on your shoulders. So just enjoy and see where you go. Take your time.
That's really important points. And I think in terms of the goal setting and then the journey, I always advocate the journey, enjoy the journey. But when I talk about the goal, you say that there is going to be an increased opportunity for a doctor to slow down, because in multiple other specialties, in acute specialties, I've seen that doctors want to apply for training at the earliest possibility, and then they'll do everything, and then they get upset if they do not get into an ST4 position. But in psychiatry, I do not think that there is such rush, and then there is an evolving and increasing demand or need for consultant psychiatrists in the NHS as such. So that do they have to really rush for and then get into through the CSR or CCT pathways, or Again, we don't want them to slack down, but then take it in a relax. Is that how you would see?
No, I completely agree. There are a lot of people who I know, some of my closest friends have chosen to continue to be in a specialist or a associate specialty role because they don't want that added pressure or responsibility, which is completely fine. This country provides you with that wiggle room where if you decide that, what suits my life is say CCT, that's also not a bad choice. If Caesar suits you, that's not a bad choice either. If staying as a specialty grade for the first 5 7 years while you have a young kid who turns 8 10 and then you decide to go into the training pathway, that's fine as well. Or if you decide, so there's no one correct answer, and hence you want to stay in the system for the first few months or years and then take a call on what works for you.